Topic for the today's session is Trichinella spiralis. It is a tissue nematode. It is the causative agent of the trichinosis. It belongs to the superfamily of Trichinella, genus Trichinella, species Trichinella spiralis. The common name of the Trichinella spiralis is the trichina worm. Geographical distribution: mainly it is seen in the Europe, United States, Africa, China, Syria. Till 1996, the infection has not been reported in India. Later, it has been reported in the Punjab. Habitat: it is an intestinal parasite. It is seen buried in the duodenal or jejunal mucosa. The fertilized female worm will discharge embryos into the circulating blood, which will be encysted in the striated muscles of pig, rat, or man. Infection caused by the Trichinella spiralis is known as trichiniasis, and trichinosis. Next one is the morphology of the adult worm. The male worm is smaller than the female worm. The male worm measures about 1.4 to 1.6 mm in length, 0.04 mm in diameter. In male worms, spicule and copulatory sheath is lacking. In the tail end, it has two conspicuous conical papillae at either side. The female worm measures about 3 to 4 mm in length, 0.06 mm in diameter. It is viviparous and it will discharge embryos instead of eggs. The larvae is encysted in the striated muscles of the horse and it will develop 100 μ and it is fully grown. By the day of 35, it will increase to 1 mm. Usually one larva is present in a single horse. Encapsulation of the larvae, it will begin in the 21st day and it will be completed within the 3 months. A blunt ellipsoidal lemon-shaped sheath is developed as a result of horse tissue reaction around the tightly coiled larvae. The calcification usually occurs in the 6 to 18 months and it will appear as a fine opaque granules. The Trichinella spiralis, in which the muscles parasites are diaphragm, intercostal muscles, pectoralis major, biceps and gastrocnemius muscles. Lifespan: the male worm will die upon week after infection. Female worm will live for 16 weeks. Larvae encysted in the muscles will die within 6 months. Sometimes the lifespan will expand to 10 to 31 years. Next one is the life cycle of Trichinella spiralis. Trichinella is a parasite and it has a direct life cycle, which means it will complete all the stages of development in a single host. In Trichinella spiralis, the optimal host is the pig and the alternate host is the man. In Trichinella spiralis, the infection will pass from pig to pig. Sometimes the infection will pass from rat to rat and pig to rat. The infective form is the encysted larvae. The encysted larvae, which is found in the muscles of pigs and other animals. How man will acquire infection means by eating the undercooked pork or raw pork. By this way, the man will acquire infection. The pork containing cyst is digested by the gastric juice. The larvae will released in the stomach, duodenum, and jejunum. From there, it will penetrate into the mucosal epithelium. The larvae will molt 4 times and it will develop into an adult worm by the second day of infection. Then the male worm will die after fertilizing the female. The worm will start fertilizing larvae by the sixth day of infection and the larvae will continue to discharge during the remaining part of the lifespan. From there, the larvae will enter into the intestinal lymphatic submesenteric venues and transported into the circulation or different parts of the body, and from there it is deposited in the muscles and the other side. Deposition usually occurs during second week of infection. Within 20 days after entering the muscle cells, the larvae become encysted. The encysted larvae will survive for many years. In man, the life cycle ends here. By this way, the infection can be transmitted in Trichinella spiralis. Next one is the clinical features. Totally three stages is seen: stage of intestinal invasion, stage of larval migration, Stage of incestation. In stage of intestinal invasion, the larva will grow into adult worm and the female worm will begins to discharge and larvae into circulation. It will happen in about 5 to 7 days. In stage of intestinal invasion, some GAT symptoms is seen such as nausea, vomiting, abdominal pain, watery stool and constipation is seen in the stage of intestinal invasion. Next one is the stage of larval migration. It is seen within the 7 to 10 days after infection. In the stage of larval migration, remittent fever, urticarial rash, sensation of crawling, edema of the eye, lips and face, inflammation of muscles, bronchitis, bronchopneumonia, and sign of myocarditis is seen. Next one is the stage of incestation. It is seen only in the striated muscles. In this stage of incestation, it is the final stage in which all the symptoms will subside and the infected larvae become encysted in this stage. Next one is the diagnosis used to diagnose few tests are used to diagnose the Trichinella spiralis. The first one is the stool examination in which adult larvae is detected. Blood examination, eosinophil count is increased. Serological diagnosis is done such as ELISA test is done. Muscle biopsy is done in the third or fourth week of infection. Sono diagnosis is done. In sono diagnosis, a biopsy is fed to the rat and which is killed within the few months. Later, the larva is demonstrated in the muscles of the rat. By this way, sono diagnosis is confirmed. Then skin test is done such as Bachman intradermal test is done. In Bachman intradermal test 1 is to 5,000 or 1 is to 10,000 dilution of larval antigen is added and it is injected into the skin and erythematous wheel-like appearance is seen in the positive case within 15 to 20 minutes. Next one is the X-ray test. X-ray is done. In X-ray, calcified cyst can be detected. By this way, Trichinella spiralis can be diagnosed. Next one is the prophylaxis. Careful inspection of meat slaughterhouse. Avoidance of eating raw or imperfectly cooked pig's flesh. By this way, the Trichinella spiralis infection can be prevented. Thank you.